Hello, I am Jay Dolredo and I'll be discussing everything about boils. So a boil is a raised red bump on the skin over a hair follicle or oil gland. Boils are caused by bacteria entering the skin through a skin wound and will be sore and filled with pus. A boil can be characterized as a bump the size of a pea, but can be as large as a golf ball. It has a white or yellow center, also known as pustules. They often have a quick growth and also sometimes oozing or crusting can occur. Boils eventually become painful because of the pressure under the skin that develops as it grows bigger. So boils may occur in the hair follicles anywhere on the body like the face, neck, armpits, shoulders, genitals, and buttocks. When one forms on the eyelid, it is called a stye. And when lots of boils form together, it's called a carbuncle. Boils begin as an itchy or tender pinkish red and swollen area of the skin. The pain gets worse over time when it fills with pus. Pain can be relieved when the boil is drained. They can drain on its own, but often needs to be opened. Health problems such as poor hygiene, problems with the immune system, poor nutrition, diabetes, or exposure to harsh chemicals that irritate the skin can make people more susceptible to skin infections, including boils. Boils are most often caused by the bacteria Staphylococcus aureus. They can also be caused by other types of bacteria or fungi found on the skin surface. This germ enters the body through tiny nicks or cuts in skin and can travel down the hair down to the follicle and grow deeper. Staphylococcus aureus is characterized by its round shape. It grows in clusters. It is an opportunistic bacteria and it is extremely common. About 1/4 of the bacterial population in certain parts is colonized by it, usually in the nose, the groin, armpits, and other parts of the skin. So here is how boils develop. The Staphylococcus aureus gets into the body through the hair down to the hair follicle or oil gland. Then it will attract many immune cells towards it. The Staph aureus can also trigger immune cells to activate vasodilation of the blood vessels, which is the widening of blood vessels to enhance blood flow as a response against it. As a result, more neutrophils that are normally circulating the body will enter the area of invasion to help the other immune cells. Neutrophils goes outside blood vessels to go to the area of invasion. The neutrophil kills the bacteria through phagocytosis, but it will also kill them, thus leaving dead neutrophils in the invaded area. The macrophages arrive to consume the dead neutrophils and turn them into a viscous yellow fluid, also known as pus, which will eventually form or develop into a boil. So to treat boils, you can apply warm compresses and soak the boil in warm water. When the boil is draining, you can wash it with an antibacterial soap until all the pus is gone and clean with a rubbing alcohol. You can apply a medical ointment and a bandage, but be sure to continue to wash the infected area 2 to 3 times a day. So, when to consult a doctor? You will need to consult a doctor if your boils is too many or in the face is too big or too painful or associated with fever. A tip given by doctors in general is avoid popping the boil by yourself. This could make the infection worse. So the medical treatment, if there are any concerns about the seriousness of the infection, additional blood tests will be performed. The doctor may prescribe antibiotics if the infection is severe. If the boil is drained, a culture test may be done to determine the type of bacteria causing the infection and to assess if an appropriate antibiotic was given. Doctors can also remove the pus inside boils via incision and drainage. And lastly, for the prevention, you can carefully wash clothes, bedding, towels of a family member who is infected with boils. Clean and treat minor skin wounds is also helpful to avoid infection. you can practice good personal hygiene, stay as healthy as possible, and also avoid scratching any itchy part of the body as it might also get infected with boils. Thanks for watching. I hope you learned something in this video.